and community. And it is the communities who are taking charge. So thinking around this idea, I would love your insights and your thoughts on this question. What does community ownership mean for you? Uh, just relax, think for a moment, and share. So let's give ourselves 30 seconds. You are welcome to share in the chat. I've just stopped sharing so that I could read the chat. And yeah, happy to have you, Scott. Uh, okay. So we have some very nice definitions of community ownership in the chat, ranging from to a sense of belonging. Sorry, who is this? It's a very nice what you have, Julie. A sense of belonging and sense of responsibility that that we are responsible for the community. And Joanne says everything starts and finishes with community. Hi, I've seen many friends here. Really nice. Bono, thank you. Is when the communities are in the driver's seat. Self-determination. Okay, Joan is making a very important point here, and she's saying that it's not just restricted to feedback to the government. It's much more than that. Is that communities come up with their own plans. Excellent. Yeah, but and ways to execute them. Wow, what wisdom. Michelle, whatever the question, community has the answer. Weavin, please could you expand on what you are saying? And if anyone wants to uh, share and speak, you're very welcome. What does community ownership mean to you? Anyone would like to speak? Yeah. Okay, so what we are all arriving at the conclusion is where communities are self-reliant, um, they are at the driver's seat, and it's not restricted to just consultation, but they decide what they want to work on and they execute their own plans. Okay, so if this is our definition of community ownership, what do you think is the role of external people like us? Okay, Marcian, thank you so much. Um, this is my, yes, okay. If this is our definition, that communities take ownership, um, they have aspirations, they drive the agenda, then what do we do? We listen, we step back, walk alongside, shoulder tap. get out of the way, says Ranga. But at the same time, link them to the other external resources. Because uh, what I think is that it does not mean that communities take lead, that other actors like us or the government or private sector do not have a role. They do have a role because communities may not have certain resources. So that is where we come in. Okay, so we are middle women, men. Nice, Bono. Okay, 1 minute more. What is our role if we want communities to be at the driver's seat? Listening is coming up very lot. Listen to understand and and help communities realize that there is hope and that they can do something. We are connectors. Okay, very nice. I think my job is done and we can end. You know that. Okay, so let's see. Non-auto development mentalities. Please, Marcian, could you elaborate? This seems to be an important point, and if you can please do it in French, if you want. We have teammates. We have Mari, my teammate. Actually, she is with me, Mari Lamboure from Belgium, and she will be co-facilitating with me and taking some notes. So thanks, Mari, and she knows French. And we have Spanish speakers, Dutch speakers, so please feel free. So we have arrived at this definition. We have arrived at our own understanding of what should we do. So let me take you to this journey. Okay, you want to come along with me to India? Okay, yeah. So what was I doing? What I was not able to do? Let's see. So. Okay. So, this project, I was working with IDS, Idea Institute of Development Studies. It is in Sussex and it has a department on participation. And I was their consultant for India. And the project was on child labor, trafficking, and forced labor. Very, very serious issues. I had to work with 14 NGOs, which was supported by Freedom Fund. These NGOs had been working on these issues for about 14, 15 years, and there was a change, but we wanted deeper, sustainable change, and therefore we were invited to facilitate systemic participatory action research. The project chose two provinces in India, which are called Bihar and Uttar Pradesh, because they had the highest concentration of child labor, forced labor, and trafficking in the world. But in today's story, I will focus on it in the small village in Samastipur district in Bihar. And you can see in the map of India that is where Bihar is situated. It shares its borders with Nepal, which lies on the north of Bihar. Okay. Yeah. So, and three things which I really learned and which helped me was the use of systems thinking, the importance of using strength-based approach. I use a SALT approach, and democratization of knowledge. And what I mean here is there's always the tussle between academic knowledge, the experts, they know it all, and between the lived experiences of the communities. So, and we are forever trying to bridge the gap between the two. And this was what we were trying to do. So let us see how much we were successful. I will very briefly explain what I mean by systems thinking in a very quickly. I'm sure most of you know, but still. Here, in this project, as I said, we were working in a very on an issue which is extremely complex. And what I mean here is that there are multiple actors involved, there are multiple issues which are intertwined, and change in one factor can influence others, and it keeps changing all the time. It's very dynamic environment. Therefore, we had to use this approach from systemic lens, and a system is defined as consisting of elements that are connected and who are trying to influence each other continuously. Okay, so when things are continuous, how can you have fixed indicators, right? The plan does not work as we plan, so things keep changing. So we were having that lens when we were working systems thinking, and you can read on it if you want to know more. So I will explain, and maybe that will give you some idea what we were doing in practice. Okay, so I was working with 14 non-profit organizations in 2 provinces in India, and we did 2 things. And remember, it is right now the researchers like me who are taking the lead. The community is still not come. Okay, so keep that in mind as we go along this journey. So the first thing we did is we helped the communities to collect quantitative data. Quantitative data is like how many people are into child labor, what are the causes of this, what is the extent. So it gave us what is the extent of the issue in these particular communities. And then we went on to collect qualitative data. And what it meant here was 353 stories collected from communities who are affected by the issue. And the stories were around what are the causes and what are the effects. Okay. And then what we did is we mapped. If you see that photo there, there's this huge sheet on that wall, and we are reading the stories, identifying what are the issues. And we were like about 30-40 people from the project and trying to understand what are the underlying causes, why is this thing happening. And there were a lot of surprises, and these people were actually working with communities. Okay. It was also becoming clear to me, in spite of the research team saying involve the communities, they were skeptical about involving communities in the process. Yeah, but there was a change in the way the staff were thinking now. They were realizing that they had been focusing more on symptoms. Okay, let us talk to communities about safe migration, because communities are getting into bonded labor or trafficking. But what are the causes that they were not concentrating? It's not that they were ignoring it, but they thought that just by telling communities that what they could do would help them solve the problems. But problems were far deeper. And what is the lesson learned? Focus on the roots, not just symptoms, if you want a deep, sustainable change. So what did the stories bring? Yeah, they were an eye-opener. The biggest cause of the issue was health expenditure. So for some reason, people were falling sick. They were spending a lot for their treatment. They had to take loan, and as a result, it made them very vulnerable. So we cannot just say poverty is the cause. You see, there were some other issues going on here. The second was children were dropping out. And what was coming across is it is the eldest son in the family and who felt that we are very poor, I have to earn my livelihood, and that boy would drop out. And the eldest daughter would drop out to look after the siblings. Okay, so this was the second cause. The third was early marriage. So the father, in India we have this concept of dowry. So if you marry your daughter, you have to give dowry. And if the daughter is pretty young, you give the dowry is not that much. And this concept of marrying the girl early, but still they were were taking loans, okay, for early marriage. So it was clear, it was writing on the wall, I can say, to these implementers, that if we do not address these issues, this child labor, bonded labor, and forced labor and trafficking will continue. Um, so what do we do now? Because we wanted to do participatory action research with the communities. So we planned that we will set up these action research groups in the village of multiple stakeholders. It could not be just community led, because this issue could not just be solved by communities or just by other stakeholders like village leaders and health workers and government officials. And this was the process we planned. Okay, identify, it's a usual participatory action research process. A group comes together, identifies the problem, plans, implements, observes, and reflects. Okay, and then continues working. Um, and and then what happened? Yeah. So I was given the charge of facilitating the first action group. Imagine, I am sitting and I was supposed to be like a shadow person to the NGO staff who was to facilitate with this group of stakeholders. This village had a serious health issues. So we were going to work on the health issue. Okay. Um, so before starting the meeting, I asked this NGO staff member, would you like to discuss the process with me before? No, madam, I've been working with communities for 15 years. I think I know my community very well. So, so you see, there was this power issue coming between me and between him, a researcher, and he was there's a pushback from him. Oh, who are you? You know, you have academic knowledge, you don't know. And I was very happy to step back because I respected what he said. So I was just sitting along and watching what he was doing. He had these women from the community, men like their husbands. Then there were these health workers. There was this doctor, medical insurance person. So they were, you see, they were like a mixed group people sitting. And it was sitting in a circle, as they say, and it's participatory. And then starts the doctor. The doctor says, these communities, he tells the communities, you don't never listen to me. I tell you to do, you continue to have the child delivered at home. And I'm really tired. And then you come back with me with these serious implications, and then I have to deal, and people are dying, and women and men could hardly say anything. They are quiet. And then the health worker who is from the village, she says, oh, this community does not know anything. And uh, and the communities say, I think the health worker gets incentive, so she forces us to have delivery in the hospital. So I could see there is distrust. I could see there is a the power dynamics and hierarchy. So the power holders were these more educated, more powerful. The village headman who was talking, the women were quiet, even the men. So there is, in India we have caste issues. So there is class issues. So and it was very apparent to me at that moment that this is not going to be the community led. It might be hijacked either by the NGO, or it could be hijacked by these power holders in the community. Um, and then and this was not the only problem I was seeing. When I went to the community, and they kept saying, Madam, you have come from Delhi, and could you solve our problems? We have these list of problems. And I could see how they were not only passive, but that critical thinking, that belief that, oh, we could do many things, that was missing. And the NGO staff were trying to tell them. So there were these power issues also between the NGO staff and the communities. So because NGO staff felt that communities could not do things for themselves, they had to be told what was wrong with them and had to be fixed. So I was very frustrated, and I did not want it to be NGO led. So what do? I fall back on an approach which I facilitate and I really believe, but it has never been used. It had never been used on child labor or trafficking. So I go back to my team leader and tell him, I think, do you want community led? Yes. Then you have to try this approach, because uh, the NGO staff are experts and not facilitators, and the communities do not believe, they do not even believe that they can address their issues. Do you think they can do research? And he says, okay, Ritu, go try whatever, but I want community led. Okay. So then start this. I take elements of constellations approach, which is an action learning cycle, and where a community, group of communities, or a group of people in the community go through this. And what do we do? What you were all saying, walk along with the community, and using the SALT approach, which I will elaborate a little bit. In this cycle, the communities realize their own strengths, and they define what is their dream, and how can they mobilize their strengths to achieve their dream, and do their own assessment. Okay, the dream is very powerful, but where are we now? And then they make their action plan. Okay, so its entire process is community led. We are just facilitating. So what do I do? Um, what do we start is SALT visits to the communities. And we are doing many things which you said in the chat. What is a SALT visit? And SALT is an acronym. So we go to appreciate them, so that they are stimulated to take action, not to please them, but they realize their own strengths, which they have forgotten, and to listen to and learn from them with humility, because they are the experts of their own experience. We are outsiders, and we go as a team, and transfer is very important. We learn from them to apply in our own lives. Okay, so I'll give you an example. Uh, is Like those women who said, oh, what can we do? I said, but you must have done something, right, as a community. And they said, yes, you're sitting in the school. Our village did not have a school, and we advocated with the government, which was actually constructed the school, and now our children go to school, because we really want our children to study. So soon they were realizing their individual strengths, and they were also realizing each other's strengths, and that was building a strong bond. That distrust, that village health worker who was trying to tell the communities was gradually saying, my God, I'm also part of the community, but I had forgotten that I was part. And these people actually have a lot of strengths. And I was becoming this teacher, and I was trying to tell them what to do. So when the community was realizing their own strengths, and I asked them this question, what is your dream for a healthy village? And let me tell you, it was not as simple as I say here. There was a lot of pushback from this NGO, the organization I was working with. We work on child labor and trafficking. Why do we have to work on health? They could not understand, and it was like a huge struggle. Though we had done all this research, they were involved in this research. So very important, this research is that not few researchers sit and do the research and make these fancy reports. Important is that NGOs and communities are involved in research, so that they can arrive at their own conclusion. We know we cannot change people. People change themselves, right? And they will change only when they realize what is the situation and what they can do about it. So finally, we asked this question, and if you see, I'm sitting there near the wall there, and at the back you can see that there are these dreams of they had this chart, and this is the same school where the community had helped get constructed. One more interesting thing was that initially it was the women who got involved. But slowly, if you see here, we had men, we had young people, we had women, and they were drawing what was their dream. Okay, it was so powerful. And Once the dream came up, I asked them, uh, but where are we now? We need to understand. And what is this health issue? They say we are very worried. A lot of people are getting sick. Maybe we have malaria. Maybe people are dying of snake bites. We don't know what is going on. Or maybe there's a river next to the village and it's polluted. And I said, would you like to know your situation better? Yes, it's very important, they told me. The dream is nice, but we want to realize our dream. So the important is that people themselves want to do something. And this is an extremely important point. We did not set up any group in the community. The action group emerged on its own. People who really cared about. So if I'm talking about community here, I'm talking about this group of people who come together and say enough is enough and we are going to do something for our own community. The composition of the group. Now I'm talking about facilitation here. So earlier, as I said, only women were involved. So slowly, because of the common dream, and of course, we were really taking care of the facilitation. It had to be more representative of the village. So it had young boys, girls, the village headman, and of course the women. Uh, and and they became the co-researchers. Some of the women did not even know how to write, but they went along for interviews. They asked questions. So we trained the community to collect data for themselves to understand their own situation, not for us. Yeah, so that they understand their situation and they act on that. Um, and I don't even have that data. uh, but I celebrate what they do. So they collected the data, but yes, they were supported by the NGO because you see, this is where the role of the outsider, the person who can take notes and who can facilitate the process. The data was analyzed by the action research group. The findings were surprised us. It showed that the 50% of household income was being spent on alcohol consumption. Now, this state of Bihar, where I'm talking about, there alcohol was banned in 2016. And I was doing this process around 2017-18. Alcohol is banned, but those who want alcohol find their ways. So they started using locally produced village liquor. Because the demand of liquor has gone up, liquor has become this homegrown liquor has become more expensive. So they are spending more money. So they're taking more loans. You see my point? And because they are taking more loans, they are sent to repay the loan. They are sending their children for child labor. You get the connection now? So you keep addressing child labor, but unless you address this issue, you're not going to get reduced child labor. This liquor has had more chemicals. It was more toxic, so more people were falling sick. Yeah, and more loans, more child labor. So this was the theory of change which was coming. Yeah, and debt was growing. Like the ethics now, ethics of research, and that is again I'm coming back to the researcher, me, the researcher. Because of this illicit trade of liquor, there's a huge mafia. They do not want to stop the production of liquor. They're not going to like this. Okay. So I told the community, do you really want to work on this liquor issue? It is dangerous, because I was extremely worried if there's some harm. They said, madam, whether you want to work on this, we do not care. We are going to work because we have realized that it is our issue. So you see that ownership of the issue has shifted from me to them. So the theory of change is that when people take ownership, they will take action. And we were seeing that happening. I think that is one of the highest moment of my life, that they decided to do, which is good. I was scared. I don't know what is going to happen, but I was, as I said, walking along, listening and appreciating. Okay. Any questions? I've spoken a lot. I'm happy to take questions if you want.
Ritu, it's Dee. I have a question.
Yes.
When you said about that ownership, when they're taking ownership, is there a moment like I noticed there's kind of, well, I call it a tipping point, but it's kind of like where the ownership shifts and it's like a big sigh of relief for you where you go,
right.
They've got it now. Like, do you experience that as well?
Absolutely. Two places. It is, for me, it's a gradual process, because when they realize their strengths a little bit, then they realize it's their dream, not my dream. Right? The final, that tipping point comes when they say, you whether you want to do it or not, we are going to do it.
Yeah. Thank you.
Absolutely. And that is what we have to keep an eye on. That's the indicator, D.
Yeah, for sure.
Brilliant point, D. Any more wisdom questions?
There's a couple of questions in the chat for you, Ritu.
Okay.
One is, what did you use for data collection?
Okay, who's this? Use. Sorry, what did you use for data collection? Use is, we had a very simple questionnaire, which was developed with the community, and questions and the community with the NGO staff. And we had done a sampling and they went around in the community to collect that data. It was a very simple, because they are not trained researchers, so they were doing it for the first time. Yeah, is that okay? Who is JULI? Sorry. Excellent comments I'm getting.
Ritu?
Yes, Noemi?
I'm interested in understanding more if that huge work you have done has done any learning with the ideas.
Yes, there's a paper.
Because what to explain, I mean, I see it as my goodness, I'm really happy to hear what's your story about. And I've been in the ideas long time ago, and those debates about the hypocrisy of the participatory action research have been there for very long. So I'm really surprised that the attitude of that you were explaining from the head researcher, and how has that developed then afterwards with your amazing work? I mean, there was some learning, or
yeah, if you mean learning, there is a paper which I can share with you. Yes, a lot of papers were written. So I worked with some excellent people who really believe and who gave me that space, because I was working with community, so not ideas. So that I really respect. But Noemi, yes. So I am already listing the lessons: systems thinking, community ownership, and I'll come along. And Noemi, very happy to chat with you later. Thank you so much. Yes, Kausar.
I just have what you described as analysis along with the community. If you could just give an example of how that went. Because I find also that's a very challenging and exciting time. So what has been your experience when the analysis is done along with the community? Yeah,
it is. So it isn't the entire community. So these are like 15 people. Imagine, again, sitting in that school and the NGO reading out the notes, all the researchers here, and we identifying what are the themes, and these people also adding in. So it is a very simple way of analyzing data, not what we do. but identifying what are the common themes emerging. Like, for example, one theme emerged is when do people drink alcohol? So they tend to drink alcohol in the evenings, when men primarily consume alcohol in the evenings. They consume alcohol during certain festivals more. So that kind of thinking, so the analysis was more for the community than for ourselves. So that analysis itself was extremely important, but I fully, of course, and it had to be done very carefully, because anonymity is very important here. Confidentiality.
Thank you, Ritu, because I feel in literature you don't find much material on
data
how
analysis,
community does analysis, and I think from your experience, you should perhaps write an article for a larger public.
Yeah,
Just
maybe
an
we can
idea.
do it together.
Yes, because
Yeah,
I've had experience of getting community to do that, and it's very exciting. It's very unpredictable how they will move, how will they examine. But I think just now listening to you that it needs to be written up.
Yes. Thank you, Appa, for always guiding me.
Okay, thank
She's
you.
my mentor, by the way. Okay.
Thank you, Ritu. Great.
Okay. Yeah. So let's go back. Let's go back to Bihar. Are you ready, team? Okay. So when these people analyze this data, they get really angry. 50% of household income, and it is women who are also earning. It is not just men, right? And women were very, very angry, particularly because the people from whom they took loans, sometimes they came and took away their television, their mobile phone, even the vegetables that were growing in the garden, you know. And our children are going for child labor. And when I used to go to this community, you will hardly find boys above the age of 14, 15 years. You'll not see, because they've migrated and they are working in factories or in bricklins or somewhere. Okay. So so what these women and youth did, they took out marches and processions, stop alcohol. And they shut down. There was this liquor shop. They smashed it and broke the bottles and said, no one will drink alcohol. And of course, there was resistance from the men. So what happened? Yeah, so after this happened, there was a lot of conflict in the community, and we do not want that conflict, right? Somehow you feel that responsibility, what is going on. Therefore, it's so important, and a point which I would like to make is the critical role of reflecting, of looking back on what we have done, what we can do better, so that we can learn from our own experience, making sense, mean making as we can, of what is happening. So, everybody's reflecting. I am reflecting. The NGO staff are reflecting as they are stepping back. They are saying, are we listening or are we teaching? Are we appreciating or we still continue to be the experts? Similarly, the communities, and communities are like us, right? We all learn by doing, we all learn by making mistakes. So we had this meeting, and where the women said, we are having arguments at home because there's no liquor. And what is happening is the men now have started buying liquor from the nearby village. So the liquor consumption has actually not gone down. And it's created not that good atmosphere in the village. So I said, what do you think we should do now? They said, okay, let's have a conversation with the men. So we invited the men. At this moment, the men are not that involved, okay, especially who were drinking alcohol. And they come and say, in the evenings when we come back, we are very stressed and we like to have liquor. And so we asked them, like, what do you think you can do to address this issue? They said, we will never stop. It gives us a lot of pleasure, but we can reduce. And if we'll feel much lighter if we play with our children, if we chat with our friends. It is being triggered. See, there's another. Why are they doing it? Because they're so stressed about work and about what is happening. Their children are not at home, they're out working. So that entire atmosphere is kind of triggering them to excessive use. So they start reducing alcohol. And that is when things change. So women had also slapped and physically, assaulted men. And so these are the kind of reflections. Men also realize that our vision, our village dream is that our children do not work. They are healthy and we want a thriving community. So these kind of reflections by the community lead to reduction in alcohol consumption, which reduces debt and loan, and we see reduction in child labor. So this is what was happening there. So the environment improved. That village liquor shop reduced its hours of working, and we see, as I said, reducing cases. I'm almost done. Okay, so what are my takeaways from this? Is whose knowledge is valued? Yeah, lived experience or my experience as a researcher. And I have come to the conclusion that both kinds of knowledge are important, but the lived experience has to take the center stage. From lived experience comes the academic knowledge. So we start with lived experience, and they are the center, and we are the facilitators. We are the connectors, as Bono said. We link them, as Ranga said, but they are the drivers. Who takes the wheel? They, and we are their co-travelers. Ethics, I've already shared. Also, building on has small groups in the communities, tap on their strengths, like self-help groups, youth club. That is another learning I got, because sometimes this community was really, really poor. So these groups have more, some kind of resources, and they're already collectivized. So tap on the strengths and the assets of the community. Level of engagement at every step. We that is people from outside, reflect who is owning it, who holds the power, who decides, and last, whom not to include. So I have a question to you all. Who do you think we should not include? Or in this case, who could have disrupted the process? Anyone? Participation is also about who not to include. Anyone, take a guess. It's okay.
Politicians?
The people who sell the alcohol, make money out of it?
Yes, both. So absolutely, you got it. So the politicians, in this sense, because it is banned, right? The government is not going to like it if we say, right? And we weren't actually including politics. It's a very village level intervention, but definitely. And those who produce alcohol, those who are middle, the pimps or the people who took children away for child labor. And earlier the parents used to send. Now, if someone was sending their child for child labor, this action group would tell them, come and stop them. Please do not take your child. What is the issue? Why are you sending your child for child labor? Earlier, even if this was done, they would call up the non-profit and say, come and help. But now the community was not even waiting for this non-profit. They had learned how to address their own issues. So when community learns to address one issue, they get into this habit of addressing other issues. So they were also stopping child labor. Yeah, so excellent responses from everyone. Yeah, it was not that easy. It was, I have a limited time and I've been speaking for a long time. Engaging men, especially when alcohol became an issue. And men were very cynical. And men generally, I found in that community were more interested. They were talking about livelihoods. It is again that pressure on men that they have to earn livelihoods. So they would come if you have a vocational training program or if you offer jobs. But if it's issue about health, it is the women who step in. So engaging men, but what helped was the dream. It became their dream. And what helped was when they analyzed the data and they realized how they were harming their own children by their behavior. Yes, and as Karen, I think, said about politicians, so advocacy, advocacy on what had been done the NGO could not talk about it much because alcohol is banned in that particular state. So then as I look back, I had limitations as a researcher. I was working with middle management or field level workers. SALT or this way of working could not be institutionalized. It remained to that level. And we know that that is so important if we want sustainability. The community wanted to transfer this to other communities, but the project stopped and in between, and so we could not facilitate that, but the community had started encouraging others. This project was for 18 months. Yeah, so I think if we had stayed on for a year, we would have seen this community spreading it to other communities. And for everybody, especially Noemi, this is the paper. And there's several blogs which I can share with you. So this journey ended here, but my journey continues. But now I want to learn from your journey. Okay. Any reflections on what I said? Any sharing your thoughts? This is a time, let's learn together and co-create.
I'll start, Ritu. It's one thing that has always amazed and it's not surprised because it doesn't surprise me, but about your work, I've always admired it because it kind of, it shows that a strength-based approach can work on a very large community scale, like on large issues. And, we get kind of the critiques of ABCD sometimes is, you're looking through rose-colored glasses. Communities, you've got real problems. You don't even understand. And I'm like, no, you don't understand. When you start with strengths, you find what you've got to address them. And I just don't get how people don't get that. And so I always love hearing your stories. And because I know of many of your other projects, of course, and it just makes me feel really warm and really happy, that this is not just about helping a neighbor in a little street party. That's great. And yes, it can be that. And it can be so much more. So thank you so much.
Thank you, Dee. So honored to hear this from you.
Mm-hmm.
3 hands are up.
Yes.
Ritu, you choose.
Whoever wants can't stop.
Also, your hand was up first, so you should go.
Okay. I just want to make 2 points. One, I was thinking, how strong is our community, the community that believes in community, that believes in the centrality of the community. And we can give good argument as to why we believe in that. And the pedagogy that we use that keeps establishing. But I don't know how big is our community. And somehow we need to strengthen ourselves by maintaining a connection. For instance, I worked on equity a lot, and there's an Equinet, and the Equinet in South Africa is very active. So I stay connected with them and their new work, etc. So I feel we need to have our own community to be able to see how many we are, how strong we are, and how we can expand. My second point is, a couple of years ago, I discovered that there's a Congress on Participatory Action Research. I was amazed. I said, I have no clue. So it was in South Africa. I went there on my own. It was, I think, the 13th Congress. And there were some excellent people there. There was a couple of book launches, people there. And after that, I became a member. Then after that, I lost track of it. And I think we should track them down and see whenever they meet that we continue to be part of them. And once COVID is down, because that also becomes a way of meeting physically also. The Equinet people, they were in Zimbabwe, so they came over. So it was nice meeting them at that Congress. So I feel the connectedness of our group is to be thought through and established. So that's all I'd like to say.
Yeah, I think that's why Dee and Michelle are doing this event. And we're very thankful for them. Yeah, but we need more, I think. We need to think through.
Yeah. I only had one comment, but actually Kausar's point brings on another, which is there are people using words like participatory action research, but it's not really very participatory. It is still informed by professionals. So that's one area that I'd also like to explore. How do you really listen to the voices of the community members and make that truly participatory? And I guess in Singapore, one of the things is with ABCD practice, participatory action research seems to be the way of reporting. So it is, again, reporting back on funding that you receive from government sources or from grant makers, right? And somewhere there, I do find that we are tarnishing the feedback from the community. So I'd really like to explore how that can be done in a more, in a better way that actually looks at outcomes. The second question I had, Ritu, was about sustainability. So when you do a project like this and then you exit, what actually happens to the community? Because I find that in working with several lower income neighborhoods in Singapore, it is a constantly changing group of people, because within communities, they also fight or they form factions. And the same people who started the project may exit and new ones may come in. So it's always like a restarting, maintaining that contact and communication with everyone, and also not be drawn into the politics, the community. What I mean by politics is not the government politics, but the internal politics among people. So that was my question about sustainability, actually. How does this projects like this continue? Who continues?
Let me not be the expert. We've got experts sitting here. If anyone would like to respond to Ranga, I can always respond. So her first question is, how can it be truly participatory? And second is sustainability. Anyone like to respond?
I could give an example about sustainability from some work I did, if that's all right. Yep. So I was working with the Islamic universities in Indonesia for a few years, not living there. I was flying in and out. But what they were looking at was they would send up to 4,000 students a year out into placement or service learning, whatever it was called. And they would go out for a month, do something, working in a village, and then it's finished and they come back. And they were getting, reports back from people in the village saying, jobs were half done and things were being left and, all that kind of stuff. And it seemed like a really simple thing, but it wasn't. Like, we really had to go through the process of looking at that. How can this be sustainable? And so what ended up happening was they reshaped or reframed the program. So then what happened was they developed projects with the villages. And so they were long-term projects. And then a student could just drop in for a month and they'd say, here's where we're up to, you do this bit, and off you go. And then next student, here's where we're up to, here's your bit. And so they found by doing that, they did get much larger stuff done. Like, one of my favorite ones was a local industry, like a factory, actually stole this village's river. They diverted it and stole it and took it away. And so by using the principles of ABCD and a whole bunch of students and a whole bunch of action, they reclaimed their river and brought it back for their fishing, their cooking, their washing, their everything. And I just love that it was kind of like the power of having a project, but it was like that people were really, it was heartfelt, it was passion, and it was like, we're going to get them, and we're going to reclaim what is rightfully ours. And it was really amazing. So I think what I learned from that around the sustainability was, what does sustainability actually look like? Can we reframe what we already have? And if we can't, then maybe there are just some times where things are over. Sometimes there's the wax and the wane in different things that we do. Sometimes things are just finished, and sometimes we have to kind of face that reality. Even if we're really passionate about it, we might have to let it go. But yeah, the reframing was probably my key learning for that into sustainability.
Thank you, Dee. Ranga, I'll just add one thing. Is I think if you're talking about funding here, then it has to be systemic. It's a systemic issue, right? So it is the funding agency, the implementing, it all have to shift. We cannot do it alone, and it needs a lot of negotiation in the way they think. So yeah, just adding that. And I would really call this truly participatory, because people collected data for their use, not for our use. And Ranga, happy to chat about it. So any other thoughts?
Yeah, I just wanted to say thank you for an amazing presentation. It was very deeply engaging. And I did spend a lot of time at the beginning going, when's she getting to the alcohol bit? But it was great how you took us on that whole journey of, because obviously it wasn't there at the beginning, right? You had to really dig deep and uncover it. It's so inspiring. I'm more in the space of the community get together, less deep and meaningful. But I found this very, very inspiring. I'm just wondering, in terms of getting the villagers to come on board, I often hear, you've got to get the cultural leaders, you've got to get kind of the important people in the room, or it won't work. Did you have any of that, or did it just it didn't really matter?
Of course,
I know you talked at one point how you had the women and then the men came in and the young people later. Yeah. I just wondered about that a little bit.
Yeah, so we did approach the village leaders, it's not that we ignored them. But I do not know how to explain. We've got many SALT facilitators here. We were also appreciating the head, the village head. He was this 65-year-old man. I can still remember him. And he had never, people were kind of, he had this people, if I may use the word flattery. So people were trying to please him. But we were connecting with him at a very deeper level to appreciate and listen to him. But at the same time, we were also helping this person realize that others have strengths. And it was it wasn't artificial. It wasn't list down what are your strengths. It wasn't that. it was a very facilitated process where people could realize their own strengths by not pointing out. That is the very important, if you're talking about asset-based community development, people have to feel it should come from within. And when people start realizing each other's strengths, that is when things change. Like Dee asked me when things change. That is another indicator. Till this does not happen, we do not ask, what is your dream? And someone had asked the question. It took about 3 to 4 months of SALT visits to the communities. And that is when I asked them, what is your dream? I just did not go and ask them, what is your dream? Because if you ask that, what is your dream, then it becomes a wish list. And this leader was also drawing. He was drawing his dream for the community, and these were young girls. And you know, that was also shifting. There was a shift. Thanks a lot. I'm just remembering those beautiful times. Yeah.
I just want to pick up on something you said then, Ritu, because sometimes it's when those leaders come in with their answers to their problems, and that's what they work towards, that there's no passion in the community for that, and the community feel more disempowered because nobody's asked them, and it's that sense of community development being done to the community rather than with or by the community. So it's always that, you know, and sometimes it can be tough if you're working in really patriarchal communities where it's always the men that have made the decisions or that have said what's going to happen. It can be really hard to change that, you know, because you get pushback from generally those men who want to do it their way.
This is so important. We did not face that because somewhere with the head, we were able to deal with that. But this is very important. Let me tell you, I was working with 90 communities in another province where 20% of the community start responding. Okay, but the village head does not like the community taking power. So he stops the community for attending those meetings. So in 20% of the villages, the community stops responding. And it's also, you know, it is a red flag for the donors. And why I say that? Because they have also been giving to the community. So this community says, oh, they don't give us anything. The village head does not want us to attend. Why should we attend? So that savior mentality also, and the power dynamics. Michelle's point is very, very important. Otherwise, it's watered down community participation. Yeah. Thank you so much, everyone, for raising these really critical questions. We have a long way to go. So, do we close this meeting, Michelle? We do not have anything. Yeah, we're done early.
We can certainly do that if you've finished, Ritu, and there are no other questions or anything from anybody else. We can certainly wrap this up.
Yeah. So before we close, what is your heart say? Any reflection? How are you feeling? One word for a checkout, and then we close. Would that be okay? Yeah, everybody, one by one. I can start from the list I can see, and I hope I do not miss people. Ranga, your name comes first. Yeah. And I would love to hear your voice, everybody.
I'm going to use 2 words: inspired and sense of solidarity with everyone here.
Yeah, absolutely. Noemi? Your mic is on mute, Noemi.
Oh, yeah. Sorry. Yeah, I feel like with admiration at the moment. Really, Yes, and with hope. I don't know, like this hope with the connections on this learning that what can be possible.
Yes. I also love this community. So thank you so much. Mari?
Thank you, Ritu. Passionate as always. Thank you.
No, it is not for me. It is for what you feel. But thank you so much, Mari, for coming. Marcian?
Really inspired and many takeaways. Thanks for this session.
Mercy. I hope I don't miss anyone. Joanne?
Yeah, Joanne. Yeah, just very inspired to see ABCD working in such a different context to the one I work in.
You brought in a lot of insights. Thank you for that. Marcian, is she there? Love to hear your voice. Let's hear each other's voice, right? We're coming from so many parts of the world. Okay, Joanne. Joanne has spoken. Birgitta?
I'm very impressed with the depth of what happened over a long time. Your stamina, your patience to see everything evolve. I would have been really confused. I would have been frustrated. So I'm really impressed with you trusting the process and taking time and let it come.
Vajita, it wasn't like this. I was crying. I was frustrated. I was crying. You know when? When I was listening to the stories. The 350. So I have not slept for days. Okay, Scott.
I'd like to thank you for sharing your story with all of us. We have a better understanding of your work here. And I think it's very important for all of us here to share our best practices. There's so much for us to learn from each other. There are similarities and differences, but we can always learn and grow together. So thank you so much for sharing today.
Thank you. Scott does amazing work with young girls. I wish he was there presenting. But it's thanks to people like Dee and Michelle who are creating that space. There are many nice sessions, so please check them out. Don't miss them. We win from Indonesia. We win. Are you there? Okay, maybe she's not there. Karen?
Excited. Thank you very much.
Where are you joining? Australia. Okay, you're joining from Australia.
Yes.
Nice. Who else? Dee and Michelle, if you would like to say something, and then we close. I'm leaving my email ID, and we have someone new. We have two people, Geeta and Fikru. If you would like to say something.
Michelle, do we say it together? And everyone puts us together. They often think we're sisters or we're the same person. Or what's the word we'll use for Ritu? Admiration. We go with that.
Yeah, admiration. There we go. That's it. Be each other's echo. Yes. Inspired admiration.
Yes. So admiration, but for that community, you know. Yeah.
For all of it, the whole story, everything. Thank you.
Yeah.
Thank you. Yeah, I'm joining from Ethiopia. Nice to meet you all.
Nice. We missed learning from you, but very happy to have you.
I lately joined.
Okay. Okay, Geeta from Iran. Wow, very nice. You've got people from all over. So I'm just leaving my email ID. Would love if you would like to connect with me. Okay. So thank you everyone for listening. It gave me a lot of strength and courage to continue my journey. And special thanks to Michelle and Dee, who've mentored me and who've always been there for me. Thanks a lot and take good care and enjoy the conference.
Thank you.
Thank you, everybody.
Thank you, Ritu. Thank you.
Bye. Lots of love.
Bye.
Thank you, Ritu. Bye-bye.
Bye.